Welcome to this session on recognising training pathways and supervision requirements for 5 key roles in primary care. In today's session, we will recap the 3 different types of supervision as defined by NHS England. This will be a brief reminder, and so if you have not already done so, we recommend reviewing the chapter on understanding the 3 different types of supervision before you begin this chapter. We will cover 5 chosen roles in primary care and focus on their training pathways, supervision requirements, and how they differ for each role. We will also signpost you to resources for you to find out more. The roles we've chosen are clinical pharmacist, paramedics, physician associates, physiotherapists, and practice nurses. Before moving into the 5 different roles, this slide is a quick recap of the 3 different types of supervision. Let's revise what good supervision looks like under each of these headings. For educational supervision in green, you will understand that the supervisee's skill set on arrival, identify learning needs, assess competency, provide training, and flag any problems. As a clinical practice supervisor or a day-to-day supervisor in orange, good supervision looks like being accessible in real time, minimising barriers for providing support, offering appropriate time to do supervision, and promoting a culture of asking for help. As a professional supervisor in the red column, your role is to know a supervisee and their strengths, weaknesses, and interests. Know their competencies required for their role and provide protected time for learning, promoting trust and well-being. We explore the training pathways in more detail. I invite you to consider a time when you have supervised someone from a role different to your own. I will read through the guided exercise. Please pause at any time to complete the activity at your own pace. Start in the first column by listing the different roles at your practice, underlining those who you have supervised before. Next, list factors that make supervising that individual straightforward, and another list of challenging factors. It is possible that you've not had the opportunity to supervise someone from outside of your role yet. In this case, imagine what the possible straightforward or challenging factors might be. Lastly, think about what other information would be helpful in the supervision contact to reduce any challenges. Interprofessional supervision has been a topic discussed throughout the series on supervision. Here are some of the factors that have commonly come up in those discussions. When we think of potential challenges, it is recognised that supervisors may lack knowledge about other professional training pathways. It can be challenging when supervisors do not know what to expect in terms of a supervisee's capability and competency at each stage of training and even post-registration. Some supervisors have fed back that they feel uncertain about trusting the supervisor's knowledge or clinical skills and have felt uncertain with managing that risk. On the bottom of the slide, we have outlined some resources where you could find out more information to help overcome some of these challenges. Each of the 5 NCL boroughs has a multi-professional educator group, known as an MPEG, with a named contact who leads on the delivery of workshops for supervisors. Further details, including contact information about these MPEGs, is at the end of the chapter. Arranging a meeting between supervisor and supervisee early in placement can help identify learning needs, which should include competencies and capabilities. There are also frameworks for each profession, which include more detail on what to expect of the supervisee at different stages of training and post-registration. For the rest of this chapter, we will summarise for each role the training pathways, supervision requirements, and where to find further information. In this section, we will explore training pathways and supervision requirements for practice nurses, and where to find further information. All nurses must undertake a BSc nursing degree. To become a practice nurse, they undertake one of two different training programs, either a GPN foundation program, which can vary between 3 to 6 months depending on the university, or a 1-year academic program, which consists of 9 modules and a portfolio. Once they finish their foundation training, they can go on to develop skills in a particular clinical area or in education or leadership. Regarding the supervision of a GPN during their GPN academic or foundation training, it is required that they have a supervisor and an assessor, and that these individuals should be 2 different people. A GPN trainee can have more than one supervisor, and those can be multi-professional, however, relevant to what the GPN trainee is learning. For example, a supervisor can be an LTC competent pharmacist during the GPN trainee doing the LTC module. During the cervical training, the supervisor must be a fully trained active cervical screening taker, whether that is a GP or a PA. The assessor must be another GP nurse. The GPN, or General Practice Nurse Career Framework, developed by Skills for Health and Health Education England, provides a structure for the career development of nurses in primary care by defining 6 career levels, from support worker to consultant level. The associated Core Capabilities Framework outlines the essential skills and knowledge required at each level and is organised into 4 domains. 1. Personalised collaborative working. 2. Assessment, investigation and diagnosis. 3. Condition management and treatment. And 4. Leadership, management, education and research. These frameworks aim to standardise practice, support workforce planning, and guide professional development for nurses in general practice. They are useful documents to refer to when supervisors meet their supervisees early in placement. Supervisors could use this framework to help the nurses to identify where their job sits on the framework, develop future learning needs, or plan careers. It can be used in a performance review to identify and evidence their capability. The tool can be used in self-assessment, self-reflection, and as part of a personal development plan in appraisals. On this slide, we can see and understand who can supervise who in primary care. A GP can supervise any of these roles, but must have undertaken the GP supervisor course and completed Training Hub approval. Only GPs can supervise a physician's associate. Otherwise, anyone from any professional role, as long as they've undertaken the London Multi-Professional Supervisor course, can supervise, for example, a clinical pharmacist, paramedic, physiotherapist or practice nurses. Please note the subtle difference with MSK first contact practitioners, where their educational supervision is provided by the higher education institutes. For further information about supervision requirements, please access the resources at the end of the chapter. Any of the 5 roles discussed may progress to become advanced practice practitioners and can come into contact with patients from an undifferentiated list. Early this year, a revised version of the Workplace Supervision for Advanced Practice was published. In broad terms, the document emphasizes that supervision is an ongoing process and has no finite end date. There is an emphasis on it being multi-professional and flexible, where the supervisors must be capable to supervise the relevant domain. It makes the employers more accountable for the provision of supervision of quality and ensuring time is made for it in the supervisee's day. There are clear recommendations for the employers too, such as a requirement that ensures 1. Appropriate supervision arrangements are in place. 2. Supervisors have access to learning and development opportunities, enabling them to provide effective supervision. 3. Advanced practice workforce and business planning includes identifiable provision of supervision. 4. Advanced practice workforce and business planning includes identifiable investment in supervisor development. There are also 2 new terms to help describe supervisors. One is the title of Coordinating Education Supervisor, who is a primary supervisor. The other is an Associate Workplace Supervisor, who is a more supportive role. There may only be one Coordinating Education Supervisor, but there may be many Associate Workplace Supervisors. I will explain this more in the next slide. The Coordinating Education Supervisor provides overarching supervision and coordination of the learning of the supervisee and is able to oversee the progression of the supervisee. In contrast, the Associate Workplace Supervisor provides more targeted support with a focus on specific areas or topics or skills. Together, they ensure safe, effective development to advance practice. To summarize what we have learned in this chapter, we have talked about and listed potential challenges when supervising someone from a different role. You have an awareness of training pathways of the 5 different roles, an awareness of supervision requirements for each of those roles, and you should know now where to find supervision guidance for any of those roles who are taking on advanced practice. At the end of the chapter, you will find further resources and support. Before you finish the chapter, take a moment to think. What do you want to revisit or explore in more detail? What will you do differently because of this learning? Consider making an action plan in your appraisal or discussing it at your next workplace review.